Well, I've been in Atlanta for 20 years. I worked at Northside Hospital, and I knew about Kaiser Permanente before I joined the group. So I've been with the group for 16 years. I looked at it, tried to make a decision, stayed with private practice for a little while longer, and then came to join this group because I felt like I would be able to do what I like to do, which is take care of patients. One of the things I love about OB/GYN is that there's a lot of diversity in what you do day to day. So about half my time I spend in the office seeing OB patients and taking care of women in terms of gynecology. We do a lot of primary care, really, preventive medicine. But the other part of it, we spend in the hospital. We see patients in OB, and we also take care of our surgery patients. And I can access Health Connect from the hospital. With the KP Health Connect, we can actually go into the chart. We can actually see when the patient was seen last. We can look at the lab values. We can look at the last x-ray, the last mammogram, the last ultrasound. And so that really helps a lot to coordinate our care.
Actually, my OB/GYN, Dr. Smith, saved my life. She was my doctor for probably 8 years, but I also taught her son, and for a while I stopped going to her because I didn't feel bad. And she'd come into school, and I'd see her, and she'd come in my room, and she'd say, I haven't seen you in a while, just come in. And I would just blow her off, and she'd come in a few weeks later, and she'd say, I've seen you, you need to come in. Well, finally, after about 3 or 4 years, she came in and she sat down at the desk and she said, you really need to come in for a visit. I haven't seen you in a while. And I said, so embarrassed, though, because I gained so much weight. And she said, that's just ridiculous. Call and make an appointment. So I did. And this was in September. I saw her in October, and I was diagnosed with severe cervical dysplasia, which means that I was on the verge of cervical cancer.
Had she not come in, because she hates going to the gynecologist and she hates getting that exam, she could possibly have had invasive cancer. So she and I have had that discussion, and she's told a lot of people about that because I think she knows now that it's really important that even though you hate to go see your gynecologist, you really need to.